Hey guys, it's just me, and as I told you, I'd be back. I'm going to go over a few things here, and there's going to be some just screenshots of our good old friend over the last 4 years, and you could tell me how you think that her renal cell carcinoma has progressed and if it's changed the way she looks or appears. So let's go ahead and start. I believe the first one is 4 years ago. It'll be just the photo screenshot of Jerry from 2019. So there she is. I just watched her today live and kind of looks the same. She did say that DSS did stop by her house and they kind of laughed, thinking that she looked okay. She didn't show her wounds, guys. And here she is. This is the update on Mom back in 2019. You could see she was losing hair then, and she has the black circles here under her eyes where YouTubers fail also. She was propped up in bed at this point as well. Her limitations are from herself. But I guess people don't see that. So I'm not going to let the scam of this cancer continue. She's thinking about, here we are 3 years ago, what's been happening going on. That's Jerry Ann, looks like her today, actually. The reason for the port that she has in her chest is because they found it difficult to draw her blood. So they will often put a port in heavier set people if they cannot do blood draws. Here she is 3 years ago. She's got dark circles under her eyes. Nothing's really changed with her looks except, of course, the aging process, which everybody ages. And then we got to clean and organize the craft room. Part 4, look at behind her. She's done a great job organizing, as always. Here she had a grocery haul. This was 3 years ago. Now there is one in here that is like a 2-hour long grocery haul. But just looks like Jerry Ann, right? Does anyone see stage 4? Here she is again, her Aldi haul. What I'm doing is basically just going through her photos from her videos and letting you see what she's looked like through the years. Now, if you have renal cell carcinoma cancer, your looks will change. There's a different tone to the skin. There's many things. Right now, the poor woman has infection running through her body, won't admit it, but what they did and what she said they did was treat her for bed sores. And here is another one. This was 2 years ago, and she was in her car. Many times she would do hauls in her car because she didn't want to go in the house. It would tire her out. She set these limitations upon herself. She's also talked about the mobility scooter for her cruise. Now, of course, she would need a mobility scooter if she wanted to get around on the cruise. She did say she needed a bariatric one because of her size. Well, there's a limitation. Here's 2 years ago. Are there changes to come? She was thinking about changing her channel many of times and doing different things, but she never put forth the effort to do so. Recently, just today, she warned about the FBI. This was their date day in St. Roberts. Now, here she has the little thing on her head, and, you can see the dark circle under her eye. She pretty much looks like she does today, except maybe a couple years older. Here is another Aldi haul. Still looks like the same old Jerry Ann as I see today, but maybe I'm wrong. You guys can tell me. I'm not going to talk through this whole video, but what I'll do is add some music in perhaps. This was their huge Hallmark haul. I'm thinking this is when they did the stimulus check, because I'm telling you, this video right here was about 2 hours if I remember correctly. So Jerry Ann looks like Jerry Ann. This was her 50th post-party pop-in. This is when I seen a change. When she was becoming 50 years old, her demeanor, her mood seemed to change. Now, other people think that maybe I didn't see it, more signs that she is the person she is today, that she was just covering up. That could be. But I'm not sure. You notice the thanks button in all these videos, right? And I'm going to continue on here. Here she was in bed. She was doing the distribution. Let's just say she was doing her tumblers or whatever the hell they are, because she just pops them all in her mouth at once. Now, this is when she was a medical update from bed. You know, she spent a year in bed. She's saying how she sleeps on her stomach. However, she always laid on her side, and to watch TV, it seems like she would lay on her back as well. Hence, there's where the pressure wounds would come in. Now she has some answers. Still looks like Jerry Ann today. Not much of a difference if you ask me. But this was a year ago, and I'm going to keep going down, and we'll see as we get closer and closer. Here is Jerry Ann, switch mode and switching sides, switch meds and switching sides. She was really hurting her other side probably because of that bed sore and laying in bed all the time. You see, but Jim and Lisa and nobody's understanding that. I don't understand why they wouldn't help their friend. Honestly, why would you let your friend not get medical attention that she needs? Or why would you let your friend deny the medical attention that she needs? And here we are. This was 6 months ago. Still looks like the Jerry Ann that we've seen in the past. I don't see really any signs of cancer. And you can correct me if I'm wrong, but people that have cancer, they look different. They change. Everything changes, but not with Jerry Ann. The only thing that I have seen change basically is most likely because of an infection running through her body. And she just said now she has a new wound due to the tape. Here she looks like a little heavier at the top, but she does have her, I think it's her turtle shell on, so that made her look like that. But just look at the face. That's all I'm concentrating on. Just the changes in her face and how she appears. Again, here was a coffee chat. She said it was question and answers, but she really didn't answer too much, if you remember. Her breasts were always hanging out. She was always touching her breasts. I mean, that's not anything anybody wants to watch, but okay. Shower day, yay, and lousy tape. Can you imagine? And I also want to update. She said that in today's live that no, she didn't qualify for SSDI. Well, honey, with stage 4 cancer, it's an automatic qualification. So quit lying. Here she is with her brace half on. You could tell it's not all the way up. Her eyes still look the same. Her coloring is still the same. It's the good old Jerry Ann as I see. This was just 4 months ago, guys. Have you seen much of a change, or is it just me? Maybe I'm wrong. You can all correct me. Today I've been called a lesbian, and Jim's going to cast a spell on me, but they can go ahead and do whatever they like. Here's where she was a little bloated and a little retaining water. I don't know if this was after her trip or before her trip, but this was her 3 months ago. Now, the only thing she looks different is her weight. Here she is 2 months ago. She doesn't look as chesty up at top. Maybe she had the turtle shell on. I don't believe so. I think it was just the way she was sitting. But I'm just trying to go through this whole thing with you. Here is Jerry Ann 2 months ago. Do you see any difference in the coloring? Sometimes you'll notice her lips are blue, but I think what some of it can be is because it took her a while to get into the chair and it might have winded her. You realize as she gains weight or anything, here she is 2 months ago now. Her lips do not look healthy there, but people have said that they believe she puts on the black lipstick from the Dollar Tree. One will never know. I think it's lack of oxygen. I could be wrong because look at her lips here. They look pretty good. That's 8 days ago. Same dark circles. Nothing's changed. Her hair was thinning prior to the cancer. So, and there's going to be some little things here for you to read. This was Fantastic Friday the 13th. Of course you would love that day. Yes, I do see the black circles. And her lips aren't as blue as they were before. But it looks like Jerry Ann. Here she was ringing a bell. Bye, super thanks. Go, Jerry, you rang the bell. Where were all the doctors and nurses and clapping and everything else? Oh, excuse me, it was the end of the day. So, under the SSI, you should not be given more than $20 per month in cash gifts of any source, as this will reduce your beneficiary SSI benefit for a particular month. So, she does have to worry about that some. And here is about gift cards. Really, there's not too much that will affect it. Maybe dollar for dollar. Who knows? I mean, I don't really care about any of that whatsoever. It's not about all this information. I did put in about the dental. They do reimburse and they do partials and trying adjustments for 6 months. I really think they both should do that. I really think they both could have infections in their mouth. But that's my thoughts and opinions, and I could share these. And then here's a little more thing about, Medicaid and what you can make, the poverty level and such. You know what? They need Medicaid. I have nothing against that. The only thing that I have is stage 4, grade 4 renal cell carcinoma. That is my only issue. I have no other issue. Well, I do. I have an issue with her having, oh, hold on here. This was Sheila Hall yesterday, and she was making some comments. Because I do think she cares genuinely about her getting the medication that she needs and getting her wounds taken care of. So then Monkey Mimi, thank you so much, because she came over to my channel and was posting all of the comments that were getting deleted on Jerry Ann's channel. So you could just read through these and you could tell these are bed sores. Nobody's making up this. Nobody's doing anything. So let me just play a little music through these. Well, guys, I was going to play some music over it. However, unfortunately, it said copyright free. And when I went to upload it to YouTube, it did come back that it was copyright. So I'm just coming back here and going through this about the bed sores. And there's all kind of clippings here for you to read through. I don't need to read through them for you. This is a serious, serious condition. People think that it's fun and games or that I'm being mean. No, this is a life-threatening infection. And how on God's green earth does Lisa not see it as being her best friend? That's what upsets me. Nobody is helping Jerry Ann as far as mental health, letting her realize that, hey, this is serious. This needs to be taken care of sooner than later. Also, if you're planning trips, you're risking so much. You're playing Russian roulette with your life. I'm not cool with that. You know what? We'll hit more on the renal cell carcinoma if you'd like, but right now we need to get this infection taken care of, which now I think you've basically admitted they are bed sores, which you have denied so much in the past, which there's no reason to deny. You were in bed for a year. It's expected. However, I do think your doctors did not tell you to be in bed for a year. So that's why I believe that you didn't want anybody to see it. Also, Jerry Ann, I think I asked this later on in the video, but did you actually show the DSS workers your wounds, Jerry? Be honest. They just saw you and thought, oh, you look great. Well, you know what? You needed to lift your shirt, let them see your back. You need wound care. It's nothing to be embarrassed of, ashamed of. You want to enjoy your vacation? I'm sure you don't want to enjoy a vacation with an infection going through your body and be buried at sea. Really, I'm not being mean, but think about it. This is things that you've done to yourself. You've taught your other subscribers it's okay to just lay in bed and get bed sores and ignore them. And no, I thought you wanted to be a teacher. I thought you wanted to lead by example. I thought so many things I've thought that are wrong. That's what upsets me. You need to take responsibility for your own well-being. Don't worry about anybody else, or you need to be there for your mother-in-law or Jen.
Today we're going to have a little bit of water because we have to hydrate. There is a lot of stuff happening in the universe, so we're going to make sure we stay hydrated, and we got to stay focused, and we got to stay grounded. Isn't water the best? So I want to just report that I went to the wound care doctor today. And actually it was the wound care nurse, the nurse practitioner. And she's very cool. She had a lot of recommendations. She debrided the dead tissue, which was one. She she gave me a cream to use until I can get the prescription, but she prescribed a medicine that doesn't have a generic and is not covered by insurance. So I will not be getting that insurance, that medicine. It is, I think, a couple $100, she said. So we're just going to wait to see if there's like a coupon or something for it. That's what she said. She said they might have a program. They might have a coupon. She might check GoodRx. They're going to let me know. So I appreciate all that they're doing for me. It snowed here today. So, of course, I was like, oh, of course it's snowing. So I actually got to wear my new Christmas.
Now, in my honest opinion, she didn't give too much information. She said she's seen a nurse practitioner. You would think that a doctor would want to see those bed sores. Here are things they have done. This is how costly bed sores can be. And nowadays, in nursing homes and such, insurance will not cover it. The nursing home or hospitals now are responsible for these ulcers because the patient is not being moved. This is everything about bed sores and the differences and the terms and the pressure sore. So we're just going to continue going through here. I do realize this is a long video, but some people just don't get it, why I'm so upset over all this. So it does seem like she does need help. Of course she can deny it, but who in their right mind would want to deny anything where an infection is running through her body? This is where people thought that these were fake. I'm sorry, I don't believe they're fake. I believe they are real. She said it started out like a sunburn. That's how bed sores start out. She was laying in bed, guys, for over a year. This was one that she had sent me directly through Instagram. Look at it. Do you see? Do you see the skin peeling and blistering? It's sad that she has let this go. This is over 26 weeks ago. Her two sisters did have thyroid cancer. And with thyroid cancer, guess what, guys? Just take a big guess. Did you get it yet? Here we come. The Cabo that she used, it's also for thyroid cancer. Now, I know her sister was there, and you never know with Jerry, because what doesn't make sense is her sister saying, play the cancer card. Again, here is from the website. I showed you that it is for thyroid cancer in adults 12 and older, that is spread to nearby tissues. So is this really Jerry Ann's prescription? We don't know, because how can we trust her? Here's benign tumors that destroy the bones, kind of like it destroyed Jerry's bone, correct? There's not a lot of bone cancers, guys. If there's bone cancer, a lot of it is usually leukemia. Benign bone tumors, right here we go. They can cause swelling, and it can be from arthritis conditions. A giant cell tumor can manifest with pain. So you guys can tell me what you think. Maybe I'm all off of it. Most patients, here we go. Here, I was looking at this one. Most bone tumors are benign, not cancerous, but a few cancerous, known as primary bone cancers. So usually the tumors in the bones are not cancerous. But Jerry Ann's were. I'm so sorry. Here we go. Just a little more information on benign bone tumors. Today they did speak about benign, and they said benign can turn into cancer. In addition to factors, here's some may also lead to development of obesity, alcohol disorder, liver disease, glucose intolerance. So I just wanted to put some information in so people can see it's not me saying these things. It's Jerry that has said these things. And what I've done, because nothing makes sense, I go and I look them up. I've also shown my doctor who's seen those bed sores from the beginning and said they are bed sores. That person needs help. So, of course, I want her to get help. If anybody does not understand that, she is killing herself slowly but surely, and she is doing that. Oh, here we go. Sheila Huff, you racist pig. Does it bother you that there's me and a friend and two black men? Oh my goodness, what a crying shame, isn't it? What a loser. Oh, here we go. Tell me how racist you are. New account, loser. You think I'm going to leave any of this stuff out? Absolutely not. It's my right. I could say what I want. It's my thoughts and opinions, and I'll keep going. Till next time, my friends, if you believe this is a cancer journey, then perhaps you see a purple elephant. Just saying. So I wanted to post that real quick. And here is Jerry from today. You can look at Jerry today. Yes, she doesn't look as put together because she probably didn't wake up until after 1 o'clock in the afternoon. But, smoking that weed and drinking that mead can take a toll on someone. Have a great day. Bye-bye.